Hello, everyone, and welcome to the Together We Battle podcast. I am your host, Jessica, and today we have a guest that is so incredibly helpful for health and wellness and lifestyle, and someone that our family has truly believed in and gone to for over a decade and has been monumental in our family's health. So today, I would love to welcome Dr. Marry.
Is it 10 years, really?
Oh yeah.
Really? I didn't realize that.
Even even longer for my sister and her family.
Yeah, I did not. I'm terrible with time.
Well, I think the purpose is that you are impacting people daily. I mean, you have a very, I don't like to use the word busy, but you have a very full
Yeah.
practice
Right.
and you see a lot of people and the days go by quickly.
I do.
So you don't realize that that many years have gone by. I mean,
I did not.
Xavier was 3.5 when we started, I think,
Was you
to come
really?
see you. Yeah.
I didn't realize that.
So you've been very impactful for our family across the board. And, even I tell you guys this all the time. I refer at least, if I refer one person at ADU, I refer 10
Yep.
people
Yep.
because what you've done for people and what your practice does is so powerful to help people live a healthy lifestyle. And I think that's really important for people to understand. So, with that said, one, give a little background about yourself, but also two, if you can give, people always, when they hear the word chiropractor, they kind of go, ooh, I don't
Right.
know, because they have this perception of what they see.
Right.
Whereas really, your practice is different. So, can you share a little bit about how and where that all came from?
So you said to stay focused, and then you gave me that huge option right there.
Sorry.
I started years ago with chiropractic for myself because I hurt my neck. And honestly, when I was in school, one of the first things that they did was a big intro, and they said, "How many of you in here have been to a chiropractor?" And I expected everybody's hand to go up, which was not the case. Most of them did, but not everybody. And then it turned into, what started that for you? So for a lot of us, it was an injury or something along those lines. But at 16, I couldn't turn my head. I was backing up my little Volkswagen Beetle like this, and I couldn't move because I got hurt working out. So I started seeing a guy, and I thought, this is amazing. I was in martial arts from when I was 12, and I thought, chiropractic is martial arts, but not destructive, because in karate, you're learning to manipulate people and twist them and do stuff. Whereas with chiropractic, it's not a manipulation, it's an adjustment. But it really began that process of understanding physiology. And the guy that the doctor I was going to at the time, he had a really good understanding of how to explain that process to people in simple terms. There wasn't the amount of research available then that there is now. And so he kind of pushed me off to school. So I graduated in 99. We've been here, well, not in this office, but we've been in practice 26 years. So pediatrics, sports, family health, and then neurodegenerative issues is kind of where we come from. I think the thing that makes us a little bit different, it's not that we're different. We're just doing what chiropractic always was. Chiropractic was always about neurology. Somewhere along the way, we kind of lost that. People started getting into bone discussions or even into the whole insurance fray, which happened in the 70s and 80s. There was all this craziness that kind of divided chiropractic. So I think we're just kind of back at our roots. The guy that put chiropractic on the map was B.J. Palmer. He was the son of the developer D.D. Palmer. He had more research equipment in his lab at that time than anywhere in the country, any medical school, any osteopathic school, anywhere. And his whole focus was, what is the neurophysiology of the body doing? And is there a change in that physiology in a way that's impacting that patient? So we're just following that. We just have new technology for it.
Yeah. Well, you're right too, because people always say, oh, you're going to get adjusted, you're going to get your bone moved. And I'm thinking, no,
Yeah.
that's not right. So share with people, you talked about adjustment versus manipulation. Give
So,
people what does that mean? Because you also too talk about subluxation and
right.
people don't know what that means either. So can you give a little more information on those things?
So chiropractic has one functionality, and that's to address subluxation, nothing else. So subluxation, and this is what I actually do this with every new patient. It's not bones out of place. They never pop out. And we don't push them back. if your bones pop out, you need surgery. And that takes massive trauma to do. So that's not from weed whacking or sleeping poorly or working out and having an injury. But a subluxation is an injury to a joint. Every joint has 6 ranges of motion: your fingers, the little bones in your ear, your spine, everywhere. If you lose one or more of those 6 ranges of motion and you can't recover it on your own, because sometimes you bang things and they recover, but if you can't recover that on your own, then that joint or those joint mechanics are lost. Well, every joint in your body is lined with nerves. In fact, every single part of your body is lined with nerves inside and out. So that nervous system is communicating with the brain 24/7. And if it's working properly, you don't think about it. You do whatever it is you're going to do. And that's the beauty of being healthy. You just do your thing. But when there's a change that occurs, that signal goes up to the brain, and the brain says, I don't know how to fix that, so I'm just going to clamp everything down. Short term, that's a fine idea, but long term, you start to get chronic muscle spasm, you get blood flow changes, and when that persists, you get tissue degeneration or alteration. If you go to the gym and work out, your muscles get bigger because you're putting a load on them. That's an intentional event being done in the normal framework of exercise, which is the normal framework of joint mechanics. If you change those joint mechanics and you load that system, then that joint begins to break down. The muscles change, the tendons, ligaments, the blood flow, the nerve, and then ultimately the brain. So that's where we see arthritis, degenerative changes, weakness, decreased range of motion. That's what a subluxation is. It's a complex, not a bone out of place. As far as a manipulation, osteopaths manipulate. So there's 3 main types of doctors on the planet. There's DCs, that's us, Doctor of Chiropractic. DOs, Doctors of Osteopathy. They've been absorbed by medicine, but that was their original title. And then MDs, they're the only doctor that writes their name backwards because they're doctors of medicine. I don't know who switched that, but that's where they are. So osteopaths manipulate for the purposes of establishing normal lymphatic flow. And that's really important, and they're valuable, but it has nothing to do with adjusting, and adjusting has nothing to do with manipulation. The terms are not interchangeable. So when we're adjusting, the purpose is to normalize those joint mechanics so that return of function occurs, but more importantly, so the brain gets a normal input. When it does, it will then begin to retrain that tissue. If that change in brain activity occurs over time, then people heal. If not, you're just treating symptoms. The problem is, I think a lot of people have dumbed down the language. We were told in school, hey, don't use the big words. Don't show people x-rays for too long. It confuses them. If you're going to talk about tests, keep it really simple and short. And I think people are smarter than that, especially today. I also know that I want to know what's going on. So if I want to know, you probably want to know. So we do talk in those terms to people, and it takes a little bit longer. But it's important. But it's also why we do classes, because some of those concepts need really a lot of time to get into, and people need an opportunity to have questions. But I think people can understand brain function, joint function. Maybe they're not going to understand at that anatomical specific level, but they know their bodies, and I think they want to understand where that came from.
So as you speak about the brain, people fall and have an injury and don't realize, it may be an issue from childhood that was actually never fixed. And that could be why they have anxiety or just ongoing issues that they can't get out. You talk sometimes in your classes about getting in like a spiral loop and of negativity, and they can't get out of that. And that just brings you down a dark hole. And we all know that makes a big difference. Mindset is a huge, huge, huge ordeal.
Yes.
So if someone at any point in life is running into an issue of, mental health, I guess we'll say, issues and things like that, could that be, just for some quick reference, could that actually be because they had a brain injury that they didn't realize they sustained?
So I can give you one better than quick reference. There was a hospital that was built called Clearview Sanitarium in the 50s. It was a chiropractic facility. Now, they employed different types of doctors, but it was a pure chiropractic facility. They saw only mental health cases, and they only saw mental health cases that had been failed by standard care at the time. Standard care at the time was pretty basic. There was drug therapy, but a lot of people were being institutionalized. And the healthcare model then and now hasn't really changed much, because we did just talk about in class the other day, there's a Freudian model, and a Freudian model says you suffered trauma as a child, that's where all your problems are. We're going to talk about them, but we're going to medicate you because you're probably overwhelmed. And long term, that's not a good model because it shuts your brain off. Medication tends to shut your brain off. I understand there are people who maybe are in that process and who maybe need that, at least initially. But even those depressive patients, 5% are at risk for suicide. And so certainly there's other interventions that need to happen. But that that facility, Clearview Sanitarium, had an over, I think, 70% success rate with patients that had been given up on. So much so that the local judge who was responsible, and I can't remember the county he was in, who was responsible for mandating patients into that facility, or excuse me, into institutions, started sending all patients to Clearview first. He said, I will not send you to the institution until you've gone through that facility first, because you have a much greater chance of recovery. Now, they had records and records and records and studies were going on, but the place burned down in the late 60s. And of course, we don't have that research anymore. But that's ongoing. There's a doctor in Florida down working out of Florida State University, Jay Holder, who's been doing that research with both depressive patients and addicts since I think the 90s. And again, he's finding the same results where we're seeing much better outcomes with those groups, because at the end of the day, you can't fix psychology if neurology is broken. And everybody's on Dr. Dan Amen's coattails right now. He is one of the big psychiatrists in the country that finally woke up and said, hey, we're giving people all these drugs, because psychiatry is typically a drug therapy base, whereas the social workers and the therapists do more of the talk therapy. Psychiatrists tend to write prescriptions. So he said, we got to start looking at these people's brains. And when he did that, that was revolutionary. I taught a class probably 4 or 5 years ago now at one of the large hotels here. There was a big group that was doing CEs, continuing education, for the therapists, the social workers, the psychiatrists. And somebody asked me to speak, and I did a class on cerebellum, back of the brain. Balance and coordination is the cerebellar function that most people talk about. But the cerebellum is key to mood and behavior. And so I asked people to raise their hands for what they knew about brain function and cerebellar function, because this is a room full of mental health people. And there were 500 people in that class, that auditorium. Not one person raised their hand, not even the psychiatrist. So we have people doing therapy, or who are maybe patients who are going through this process, and you're going through it with somebody who maybe doesn't have that information. That's a big deal. Now, part of that is their educational bias and what's mandated for them by the state and all those things. But how do you not have neurology as a part of that process? They don't have to be neurologists, but if you're going to talk about normal brain function or mental health, and you don't know that piece, that's huge. And you mentioned the point of, what if they had an injury? A concussion changes brain function dramatically, and concussions left unchecked lead to Parkinsonian syndrome later in life. We're seeing this in NFL players. Yeah. So if you have somebody who had a concussion 10 years ago that didn't get corrected, which is high probability because nobody treats concussion, then you have a change in brain function. So that person is now more prone to depression, anxiety, all of those things. Cerebellar dysfunction is one of the lead causes for anxiety. So if you have somebody who's just doing drug therapy or some type of talk therapy, but that cerebellum is still damaged, their chances of being successful are extremely low. Now, when you pair that, which I've done with local therapists, we've overlapped patients. We had a young lady years ago, this lady that I work with down the road. She had OCD, so she couldn't leave the house without washing her hands 4,000 times. She would put her socks on in the shower because she's so afraid of germs. So we started working together on this young lady, and I still see the family. She and her sister at the time were out, and she took her sister's drink that had a straw, and she drank out of it, which she wouldn't even consider. That's not even a possibility because of the germ issue. And 6 weeks into care, she was drinking after her sister. It was night and day. So that young lady, like I said, I still see the parents. She lives in Chicago now and has a full life. Now, that's not because of me, but it is because of chiropractic's ability to normalize neurological function. And that gives you a foundation. Then you can put therapy on that, or exercise, or whatever else it is you're doing. But if there's no neurophysiology, there can't be psychology. And that has to be discussed.
Yeah. Well, and part of my reason of asking you about the concussion protocol and head injury is because we're located in Pittsburgh, and people are going to hear this kind of all over on the podcast. But the point is to let people know that you are a huge resource right here in the Pittsburgh area.
Yeah.
So if there was a concussion or a head injury or anything, yes, you want to have, you'll have to have your doctor, that you go to or whatever that you see originally. But you do such a nice job in your office of integrating with other practices as needed, and I think that's important for people to know. If you're in the Pittsburgh area, go see Dr. Marry if you've had a brain, literally anything, really.
Right.
but for the sake of this conversation, concussion or head injury.
Right. And Pittsburgh is known because of the research with Mike Webster and the NFL players. And I can't remember the doctor's name that really brought that forward, the movie that was done with Will Smith, talking about that concussion component with regard to NFL. So concussion, most people think if they hit their head, they have likelihood of concussion. And that's possible, but that's not the only way. Concussion comes from an acceleration deceleration event. So you don't have to have a head impact to have that. You can also concuss the cord. And the last really big part of the concussion piece is you can have an upper neck injury and it will produce all of the same symptoms of concussion, but you will not have a concussion event. The other thing that you have to keep in mind that there's no testing for concussion. There's no imaging, I should say. So there was in the works a blood test. They're close on that, but the last time I checked, that blood test has not hit the market. It's not clear. There was a saliva test being worked at a doctor in Penn State doing a great job. He's a pediatrician. And I talked to him and he was really close, but that was 2 years ago, so that's not out. And so we're not seeing that yet. There's no imaging or physical testing, so you have to go to somebody who actually deals with head injury, head trauma, and nervous system issues. When my son was concussed years ago, we ended up at a doctor in Monroeville. She was a great doctor, and she was neurophysiology, but she also had an emotional component to her practice, which I thought was great. But when I said to her, "Hey, what do you guys do for the neck?" Just because I was in her office and I had a chance to talk to her, she goes, "What do you mean?" I go, "Well, I'm sure you know that the neck is a major component when it comes to brain injury, and you can have a neck problem, subluxation, and not have an actual concussion, but have all the same symptoms." She goes, "Yeah, that's true. We don't have any way of treating that." I said, "Well, what do you do with those patients?" She goes, "Unfortunately, I don't know what happens to a lot of those people." And she was really honest, which I appreciated. But in my brain, I'm thinking, how many people are you seeing and missing this piece? Because maybe you address the concussion piece, but maybe they also have the neck piece and you've only dealt with 50% of it. Post-concussion syndrome is a diagnosis because it's a thing. So you can have a concussion from 10 years ago, and if it didn't get treated, you still have it. Now, you may have been able to overcome the light sensitivity or the noise issues or whatever else it is, but if there are other factors in there, then if they don't get corrected, they're going to remain. And if they do, you're going to then get just diagnosed with headaches later, or vision issues, or anxiety. Those are concussion symptoms. So there's a lot of people maybe running around from decades ago, or even just 5 years ago, where they didn't get diagnosed because doctors are famous for not diagnosing that concussion accurately. And you have to remember, when we talk about traumatic brain injury, the most traumatic brain injury you can have is a depressed skull fracture. So when you go to the ER, their job is to make sure you're not going to die in the next 5 minutes. So you get a CT, and if you know your name and the CT is clear, they're going to say, follow up with your doctor. I totally understand that. They're not there to treat concussion. But most of their doctors are not skilled enough or either not up on the protocols to know what's going on with them. And their answer is going to be, well, if you seem to be improving, just stay the course. If you have problems, call me. That's not the answer. There's a Berlin protocol, and it's actually been updated since then. But the Berlin protocol was designed to establish criteria for both diagnosis and treatment. If you're not following the protocol, you have no idea where the patient is in that process. So we have patients that we get that have been released from Southside's concussion program who have been seen at the hospital and so on, and they're still concussed. So it's really important that we're following up when we're seeing this, because a lot of those people are being missed. And since that Berlin protocol is not really being followed everywhere, there's people out there who have diagnoses that aren't necessarily that particular thing they need evaluated.
Yeah. Well, I know. We said we were going to have like a simple intro conversation. Here we
Yeah,
are talking
sorry.
about concussion. That's how it always works with
Yeah,
us.
yeah, it is. But it
That's
is
okay.
it is the basic, because the basic is neurology. That's
Yeah.
the neurology discussion is the foundation to all healthcare. Just physics is like the ultimate science that informs chemistry and biology and everything else. That's neurology. And you're starting to hear people talk about functional neurology and functional medicine. Keep in mind, functional neurology was first. Functional medicine came second. And functional medicine, anybody can be. In functional neurology, you have people who are eye doctors and dentists. They can still be in that boat. That's a good program. But the functional neurology is first. The functional medicine people come along, and their thought is, well, we're going to get into certain testing, and we're going to get blood work and all the rest. And that's good. But still, if you don't have normal neurology, you can't get into the other stuff, because what you end up treating is a symptom of that base dysfunction. And so this is where chiropractic really comes forward. And chiropractic was the origin of functional neurology. That was Dr. Carrick out in California. Sidney Crosby years ago, and this is the patient that everybody knows, especially if you're in Pittsburgh. Sidney Crosby years ago had a concussion, then he got hit again. Now you got to remember, athletes are back on the field or the ice much faster than they should be because it takes at least 30 days for a concussion to recover. So if you have a concussion or you see people on TV and they say, yeah, he was concussed, but he's back in the game this week, that's because he's getting paid $40 million to be on the field. So he isn't healed. You can't heal in a week. It's impossible. You can't heal in 2 weeks. And again, the Berlin protocols are clear on this. But Crosby broke down, had an injury and then another injury, and it looked like he was going to have to come out of hockey. Well, he got to Dr. Carrick, who's a chiro out in California, and that's the guy that put him back on the ice. So that functional neurology model, he's kind of the grandfather of that model. And he has brought that out into a variety of disciplines because he's working with med schools and everybody else at this point. Because nobody really owns neurology. It's just that traditional neurology is treating pathology. So brain tumors and cancer and things like that. Functional neurology said, okay, if you don't have that issue and you don't have an unstable fracture, then you have a functional deficit that needs repaired. And that's where you get into a different model of care.
Yeah. Yeah, absolutely. Well, and it's nice to have, as I've said before, and I was with you through all of my chemo treatments and everything that I've
Yep.
been through. And the nicest part about that was the fact that both doctors, my oncologist and you, were open to the idea of integrating and
Right.
having both models work side by side to get the
Right.
best benefit for the patient.
You took the exact words out because it isn't about anybody being right. It's about what does that person need.
Yes.
And the beauty is they do fit together really well. It's just having people that are willing to talk.
Yeah.
Because if you can get the neurology working, then anything else you're adding on to that is beneficial. If that thing you're adding on needs to tweak something, then maybe we can be supportive at that point.
Yeah.
So yeah, they do. They fit together really well. And everybody, it needs to be no ego in that and just what does that patient need?
Yeah, absolutely. And that's what I love. But I think too, to kind of touch back to the story you just told about Sidney Crosby was, yes, they have the resources, they have the money to go anywhere in the world to get fixed, to get back to
Yep.
their job, to get back to the field, the ice, whatever they're doing. But it's really that idea of being able to integrate. Really, people need to understand
Yep.
it's not one or the other. Let's work
Right.
together and give people an
Right.
option for a healthy lifestyle. It
Right.
doesn't matter health concern, what you're going through. Find a resource that you feel comfortable with. It's going to give you
Right.
the option to integrate. There's going to be a time and place for medicine. You say that all the time. There's a time and place for it.
Yep.
There's also a time and place for you to say, "No, thank you. That's not where I feel like I need to go at this time.
Right.
I'm going to go down the road of, coming to have adjustments and lasers and do
Yep.
brain work with you on the screen and all of those types of things that a lot of people don't realize is an option."
You're right. You're 100% right. And the ability to kind of bridge those only requires that communication strategy. That's the place I think patients need the information. That's why we talk to them the way that we do. If you have that information, then when you do go to your other doctor, whoever it is you're seeing, then I think you can have a better conversation because it also, people think, well, there's medicine and then there's the other side. And part of that's true, but on this holistic side, there's also arguing. And I don't think people understand that because, well, the acupuncturist wants this, and the herbalist wants this, and the nutritionalist wants this, and the chiropractor wants this, and they don't always communicate either. So we get people who think, hey, I'm being super holistic. They have competing understandings as well. So it doesn't matter where you're from. You just need people to talk. And if you're educated, which is why what you're doing is so important. If you're educated and you have that information, your chances of getting clarity and getting everybody to help you the way that you need, because you really need a team, is much higher.
Yeah, absolutely. I mean, it literally takes a village, just like raising children.
Yep.
It really
Yep.
does. And I had
Agreed.
Dr. Khan, my original oncologist, on for an interview a few weeks ago.
Yeah.
And it's so cool. I said that exact thing to him. I said, you and your team were so pivotal in how well I got through everything because
Right.
of the demeanor they carried in their office and the
Right.
resources that they had. It was very important to me,
Right.
but also to know that I said to him, "Hey, I'm seeing Dr. Marry. He's a neurologically based chiropractor. I'm going to get adjustments twice a week. I'm going to have lasers done. I'm going to get a foot soak done after every treatment because we need
Right.
to cleanse all of the excess or excessive junk and chemicals
Yeah.
out of our body so that it
Right.
can function properly."
You got it. It's that simple.
So that's something I really want people to understand is that, There's other options out there. You just, again, we
Right.
have to get the resource out for them to know where to look.
So real quick, there was a colleague of mine. This wasn't my patient, but this is why this is important, and this is why what you're doing is important. He had a patient whose friend, their neighbor, had a little girl. I think she was 6 or 7, who had ear infections. So people think, okay, you have ear infections, you got to get an antibiotic, you get better, or if they're really bad, you get tubes, and that's the end of it. So he had said to her, and he was early on in his practice, this is the way he was telling us the story. He had said to her, "Hey, chiropractic's really good for that. Not that we fix ear infections, we don't, but subluxation in the neck, that's the injury of the joint, causes spasm down the side of the neck, and that blocks drainage of the of the eyes, ears, nose, and throat. And we're really effective with kids who are dealing with that issue." And that's all he said to her. If she has any questions, sort of call. So the lady, and she had been bringing her kids in and her family for a variety of issues. So he doesn't see the lady for a few weeks, and she comes in finally, and she looks terrible. And he says, "What's going on?" She said, "Remember that girl I told you about, that my neighbor?" "Yeah, didn't she have ear infections?" "Yes." "She died." He goes, "What?" He goes, "She went in for tubes, and she had a reaction to anesthesia, and she died." Now that's a 6-year-old child. Does that happen with every single kid? No. Do kids get tubes every day? Yes. Is it a risk? 100%, because you signed the paperwork saying that you're okay with that risk. My point is, you saying, "Hey, people just need to know they have options," is a huge
Mhm.
deal. Because if that mom knows she has options, then maybe for that particular child, there's a different outcome. We can be wrong on our end. We can say, "Hey, you should come in, we'll check your spine." If I'm wrong, you can always go have surgery, right? Because we're going to look at parameters, do re-exams, make sure you're progressing how we think. But if you're not, we're going to go, "Hey, this isn't right for you. You need to go that route." But that lady never had that choice. She never had a choice to talk to anybody else about anything else. So this is really powerful to have this conversation. I think it's the benefit of social media today, that people get to hear way more opinions than they ever maybe knew existed, and then at least explore those.
Yeah.
That's huge.
Yeah. It's interesting you say the word opinion because on my notebook over here, I have like a few bullet points of like what I wanted us to talk about today. And the quote unquote opinion on social media was the third thing I had written down.
We're just transitioning perfectly. We're in
Right,
sync.
exactly, as usual. But
Yeah,
but
we're in
that's
sync.
exactly right. There are a lot of opinions out there, and there are going to be people that hear this conversation and roll their eyes at this point in life, and because they
Sure.
don't realize what they need or what they might come to in the future, God
Right.
forbid. But there is an option out there to have another, I don't want to call it opinion, but another opinion
Whatever it is.
from a licensed professional. And that's why I
Right.
think having this conversation with you is so important because you've been in practice for 26 years. You've seen
Right.
thousands and thousands of patients. You have literally saved 3 lives in our family. Truly. You've helped guide us
Just a
to it.
helper.
You were a helper. You've helped
Yeah.
guide us to ask the right questions or to see certain doctors or whatever because you're such an honest stand-up person that you truly want to help people, truly,
Sure.
from such a good faith-based place. And I think people need to hear that too, that
For sure.
you don't take everybody in and go, they're mine, they're mine, they're mine, they're mine, I want their money. You looked at us at one point, at me specifically, and you said, your blood work isn't showing anything out of the ordinary. Let's keep doing what we're doing. And when the time comes, and I think you need to go see a specialist, we are going to have that conversation. And
Right.
sure enough, 8 months into the process that you and I were going through, cleaning up
Right.
nutrition, what was my mindset? Was I meditating? All of those pieces, which people forget is also part of a healthy lifestyle.
Yeah. Very cool.
You looked at me and you said, you need to make your appointment. It's time. And I
Yep.
did. And there it was. There was the answer, right? So you do a nice job of making sure people feel comfortable in every conversation and when they come in for their adjustments, you talk through every piece of that. And there are
Right.
options. It's yes, an
Yeah.
opinion, but you're also an open door to it's time. You need to go.
Right. Right. Well, there's limitation to matter. The thing that drew me to chiropractic is it's based on principle. And you said that faith component, and you said you were helpful in this, and I said I'm just a helper. The beauty of chiropractic is it's based on the concept that all healing comes from above, down, inside out. In fact, the room that I'm sitting in is called ADIO. And ADIO is the just acronym ADIO, above, down, inside out. That's where healing comes from. We are faith-based. There is a God-given ability to heal, repair, grow, and adapt. However, it needs turned on sometimes because it can be interfered with through lifestyle stress, toxins, all those things. If we honor that, and then if we follow those basic principles, then it's hard not to get it right. But one of the main principles of the 33 principles in chiropractic is there's a limitation of matter, meaning yes, you can heal, grow, and adapt, but at some point this thing finally stops working, and thank goodness we all move on. If we're in a process where our bodies are working correctly, our nervous systems are healthy, and we're giving that body what it needs from an environmental perspective, both internally and externally, you can do amazing things. But when we hit that limitation of matter, then it's time to get a different tool. And that's where your other doctors work key, because they can do things we can't. I'm willing all day long to call out people and go, what are you doing? That doesn't make any sense. And why would your doctor tell you that? But at the same time, there's a limitation to what we're capable of. And so we're going to go as far as we can. We may dovetail. We may have been primary and we become secondary. It's just that conversation. It just needs to happen. And I think if we do that, then patients get well.
Yeah. Well, and that's the point, right? That is
Yes.
the point, is to live a well, healthy lifestyle. So
Yes.
talk about, you have a few principles that you share with every one of your patients that comes in, about hydration and nutrition. And there's some parameters that you tell people to stay within.
Yep.
Again, a lot of opinions out on social media of how you should eat or drink or exercise
Right.
or whatever it is. There's just a lot of information. But share what your principles are and like your bullet points that you share with your patients if you're willing to do
Yeah.
that.
The water, people, because I'm always talking about posture, water, certain nutrients and so on, like you're talking about. Posture is the first thing. If you don't have good posture, and this study was out of London, it's a 20-year study, people who slouch, they have a head forward posture or an increased kyphosis. Their mid back is sticking out a lot. And unfortunately, this is everywhere because of computers and phones and just bad posture. There's a 44% increase in cardiac disease, and that's in groups that don't have a family history of cardiac disease. So that's a big deal. That means pure mechanical change impacts your viscera, your organs. And again, there's a neurological component to that. So posture is key. If we're not rib cage up in that neutral position, then function is diminished across the board, from blood flow to CSF flow, the cerebrospinal fluid, to digestion, to heart rate, to blood pressure, and others. So posture is key. That's be the first one I would talk about. Breathing is second. Breathing is the most important thing, but you can't do it if your posture is not right. So deep belly breathing is crucial. You can do this whether you're in the car or if you have time to be all by yourself and you can actually sit and meditate. That's awesome too. But plain old mechanical deep breathing is incredibly powerful because oxygen is your first nutrient. So the argument between all of these different food practices is fine, and there are parameters to that, but oxygen's first. And if you're not well oxygenated, then your body is in a state of imbalance because your nervous system will not go without oxygen. So if that means it has to pull from the muscle or anywhere else, it will. It's always going to do whatever it needs to survive, because if your nervous system dies, you die. So there's a hierarchy to that process. The water piece is crucial because your body's made of water. Your blood's 80%, your bones are 20, your muscles are 70, and your spinal fluid's almost 100. So if you're dehydrated, you're going to have a problem. When people say you don't really need all that, you do. End of story, you do. You need half your body weight in ounces per day. That's the rule.
Hmm.
So get as close to that as you can. Nothing counts for water except for water. If you're doing an herbal tea, you could count that, but coffee doesn't count. Gatorade is the worst thing on the planet. You have to put real water in your system. And then the other thing is your water has to be clean. If you're drinking out of a plastic bottle, you're getting microplastics. One of the number one findings for stroke today is in those clots or microplastics. So you reduce your exposure as much as you can, and just be smart about it. As far as food goes, the Mediterranean diet is the best diet on the planet. Now, can you tweak that and go a little bit this way and go into carnivore? You can tweak if you want to. And if you're an exerciser and you're trying to hit a certain thing, whatever. But that Mediterranean diet is how humans are designed to eat. And whether we have cancer patients, and we do, or we have kids with ADHD, and we do, that's the diet that we're using. There was a recent study on ADHD, which has been done like 100 times. When you pull the processed food out of the patients, there's a 70% reduction in ADHD symptoms across the board. Just that. Forget about food dyes and all of the impact that those have. Red dye 40, that comes from coal tar. So you have to be thinking about what you're putting in your body and what the effects are. If you're sitting there going, I don't understand why my knee still hurts or why I can't sleep or I can't get pregnant, that's a big one. Then you have to start looking at the things in the environment because those toxins are building up in the tissue. And that means the body, again, hierarchy, the body has to deal with that before it can give you
Mhm.
this. And everything always works that way. So if we're following a Mediterranean diet, if we have good posture, if we're deep breathing and resetting nervous system, then you have all kind of options in terms of what you can do and where you'll be and where you can take that. If you don't meet those base requirements, then you're always kind of working uphill and your effects are going to be minimized or your benefits are going to be minimized.
Yeah. Yeah, definitely. So we can have conversations for hours on end, as we have in the past, but
Yep.
sure, more conversations are to come and would love to do more collaborations on different things to get this
Sure.
information out to people. Really, that
Agreed.
was the purpose of this podcast was to share what has worked and to get people to
Right.
share their stories and to bring on resources like yourself to give people the information to be like, you know what? I've been doing this over and over and over and over and it's not working. It's the
Right.
definition of insanity,
You got
right?
it.
You do the same thing over and over and expect to get a different result. If you are
Right.
doing the same thing over and over again and you're not getting a different result, I will tell you from personal, we are in Dr. Mary's office once a week. I mean, just for the ability to live the healthy lifestyle and to function properly. I
Right.
will tell you that even an hour drive is not too far to come see him in his practice and to become a patient because it truly, truly can help you. And I just want people to first off hear that. Um, but I also want you just to kind of wrap up here. You say a quote regularly, and it makes me giggle a little bit inside, but it's also so true. You talk, people are always talking about, is this genetic? Is this something
Yes.
that's in your family history? Okay, I was 37 years old. I was diagnosed with lymphoma. No one in my family had ever had cancer. Nobody.
Right.
And people, the first question is, did your grandparents have it? Did your parents have it? Does anybody in your family? Is
Right.
it genetic? So you always say that genetics load the gun and lifestyle pulls the trigger.
100%.
And
100%.
that is probably one of my favorite things that you ever say because
I didn't come up with it though.
okay, well, you can give the resource of where you got that. And,
I don't know where it came from, but it's true. It's true.
but explain to people a little bit more about what that means, if you could.
Yeah, it's an important understanding because if you think it's a genetic predisposition, breast cancer is obviously at the forefront of that discussion. And using that model, breast cancer has not really dramatically improved. There's not been a huge improvement in those outcomes using that model. And in fact, the BRCA gene that everybody talks about, just recently, last year, there was discussion that's not really what's initiating that process. So when you talk about genetic predispositions, that's all there is predispositions. And what you have to really understand is your genetics are a blueprint, nothing else. And blueprints are inert because I can put the most beautiful house on the planet in the middle of a field. And if I come back 10 hours later or 10 weeks later, there'll still not be a house. It's a potential. It isn't a reality. So genetics sit there as a potential. And without getting super biological about this, you have to have certain inputs in order to drive that genetic expression. Well, the inputs come from the sensory mechanism of the environment, both internal and external. So the external environment really quickly is just what you live in. Internal environment is who you are. People's external environments can be really good and they can still be problematic because your internal environment could be fear, doubt, and worry.
Mhm.
You could be amazing on the inside and live next to a guy that burns tires every single day and has polluted the groundwater, and you're having to deal with that. So those two environments are crucial, but they drive the genetic expression. And this is an opinion. Epigenetics has been around forever. And if anybody wants a resource, an actually really good resource on this, is Bruce Lipton has been teaching this forever. And his point is that you have that initial beginning stage, but there's a whole list of things that drive that expression or prevent it. So if I do have a family history of heart disease, and my family has heart disease on one side, stroke on the other, cancer over there, it doesn't mean you have to express it. But if you live the lifestyle that would create the proper environment for that to grow in, then yeah, you're more likely to have that because that's what's in your family history. If you're not creating that environment, There's no reason to express those particular genetics because everybody has junk DNA and good DNA. Which one you express, and boy, we could go down a really long road with this on the philosophical side of this. It's choice, right? Because that's choice, that's perspective, that's spirituality. There's a lot of ways to go with that. But the point of the matter is your lifestyle is going to drive your choices, and those choices are going to create the internal and external environment that either supports or diminishes that predisposition. So it really just turns into how are you living and how aware. So now we're back to people knowing information.
Mm-hmm.
How aware are you of what you're doing? That microplastic thing is a big deal because it's a hormone disruptor. Well, hormone disruptors have massive impacts on psyche, developmental aspects in brains, and sexuality. Well, that's a huge discussion right now on what people really are and what they aren't. Well, what if there's an environmental factor that nobody's discussing? So there's a lot of stuff to unpack there, but at the end of the day, epigenetics proves clearly genetic predisposition is not the end all be all. And that was the discussion from the 50s to the 80s. In the 90s, they started going, maybe that's not really how that works. Maybe there's more to it. Maybe the 50% of the DNA that we're evaluating coming out of the cell that we throw away has something to do with how those genes express. So that research started to change dramatically. The fact that we knew DNA was there and how it worked was a big deal. By the way, a woman discovered that. Two men, her oversight, got the Nobel Prize. But there was a woman to describe that whole thing. But that changed dramatically, and we don't think that way anymore. But the people in the trenches, which are your PCPs, they're busy and they're not reading the research. Some are, but not many, because most of them are going to say, you have this history, take this medication. You have this history, take this medication. Instead of saying, you have this history, have you considered doing this? Have you considered changing your lifestyle? Do you know about these things? Or maybe would you be willing to make these changes? Now you have a completely different set of options because you have choice. If there's no choice, then if you have that in your history, you might as well eat ice cream and wait to die.
Yeah.
But if you understand there's choices there, you can live a completely different life.
Yes.
Huge differences.
These conversations are going to get very lengthy at some point. I'm sure.
Yeah.
Sure of that, because this resource is so important. And again, it circles back to the idea of your lifestyle habits. I talk about that a lot on my platform of sustainable, healthy lifestyle, simplistic habits that you can do daily that keep you living well. Well, that's a big deal. But again, if people are always focused on genetics, and you look back and your parents were the type of people, or your grandparents were the type of people that sat around a lot, or were always eating junk food or drinking alcohol, or whatever that scenario was, living those lifestyles, and they weren't necessarily movers and getters and like on the go and drinking the water and in the sunlight. God forbid we get in the sun.
That's another discussion.
It's a whole nother discussion. Or God forbid we get enough sleep at night. Like, again, a whole nother focus that we can have a discussion on. But it's taking those habits and recognizing them and saying, well, he ended up like this because of those potential habits, because of that potential genetic. I don't want to go down that path. So what do I need to change for my lifestyle or my family moving into the future?
Yeah, and let's add a little bit of money to this, because money is the discussion. That money and time are the two biggest issues people have or think they have, is a hurdle towards health. So people go, yeah, but organic is expensive, and getting a gym membership and whatever the hurdle is. You're going to pay somebody something. I never tolerate this anymore. When somebody brings up money, I understand you might have a budget, you might really have an issue, and we work with people who are in that boat. However, 90% of the time, that's not true. It's either not understanding or being unwilling to invest in themselves. But understand something. You're either going to pay for better food or the gym membership or spend time exercising, whatever it is you're going to do, or you're going to pay co-pays and you're going to have missed time from work and you're going to have a cost for your medicine. You will pay somebody. So why wouldn't you pay this into the side of this that actually gives you a positive return versus paying into the side that says, this is how you are. You're going to be type 2 diabetic for the rest of your life. There's nothing you can do about it. That's ridiculous. There is nobody on the planet should be stuck in that process. The people that have never been given the opportunity to make a different choice, or they don't know that that choice exists. So you will pay somebody. You might as well spend it where it makes the most sense and get the most out of that you can, because at the end of the day, you have to make a choice.
Yeah, absolutely. You're totally right. And it always is, what's important to people.
Yeah,
What's important
absolutely.
to them. So, well, you and I can have more conversations. Absolutely. I'm sure everybody that's listening to this right now is sitting up taller and being like, "Oh, I need to get my water." You know,
Yeah.
you brought it to the forefront, so they're paying attention for the
Yeah.
moment. I actually saw that in your class. You started talking
When
about
everybody
posture,
sat
and
up,
everybody was like,
it's funny, everybody does, they'll sit up. When I yell at kids that we see, we might be seeing a child, and I'm saying something to the child, and the mother's in the back like this, or the dad, and they suddenly sit up. But hey, again, it's an awareness
It
point.
is. It's all awareness. And really, that's what, aside from being a resource for people with this podcast and the community that I'm trying to
Right.
build, it's really just allowing people to be aware that there's an option. And if you're in Pittsburgh or the surrounding area, definitely look up Dr. Marry. We'll put all your website and social media and everything in the show notes when we put that out. So people will know how to find your office easily. And
Got it.
if anybody's still unsure, we are there once a week. So I'm happy to pick you up on my way.
There you go. We just get a bus,
Yeah, we'll
a
get a
little bus
family
there.
first chiropractic bus and bring people with
That's it.
us.
That's it.
Perfect. Big thanks to Dr. Marry for being with us today. As you all can tell, he is going to be a wealth of knowledge and a really incredible resource for our community. So, thank you for joining us on this episode of the Together We Battle podcast. We hope you found today's discussion insightful and empowering. Remember, every challenge you face is an opportunity for growth, and together we can overcome anything. If you enjoyed this episode, please subscribe to our podcast and leave a review. Your feedback helps us reach more listeners and continue to provide valuable content. Don't forget to follow us on social media for updates, inspiration, and community support. Until next time, stay strong, stay positive, and keep battling.